Hello and welcome to the 117th Congress second session. My name is Benson-Jones and today I'm going to be presenting the CRUM bill. CRUM stands for Cost Regulation of Universal Medical Bills, and the purpose of CRUM is to require the government to regulate all medical bills and costs of pharmaceutical drugs. So this is going to put restrictions on the pricing of healthcare, health insurance coverage, and just drugs that are going towards the American people. And it's really going to lower the price that Americans have to pay just for seeking help. So by regulating the cost of healthcare attributes, this is going to eliminate the suffering of the American people because they won't have to worry about about the large lump sum amount that they're going to have to pay after being treated, or they're not going to have to worry about going into debt because the prices will be low enough that they won't have to think about those factors. They can just focus on the real purpose, which is getting better. It's also going to while eliminating that constant fear that people are living in, it will rid the American medical system of the fraud that's committed by companies that are trying to monetize healthcare, which was a service that was once purely philanthropical. So due to a lack of oversight and regulations of the cost of drugs and treatments and surgeries and just healthcare in general, many fraudulent activities go on consequently because there are no real laws. So Martin Shkreli is a convicted felon who raised the price of Daraprim from $13.50 to $750 per pill. That's an absurd amount of money for a drug that is life dependent, that people's life depends on. So people are losing lives because they're not able to pay. They can't risk letting their families go into debt. Like, everyone has a family and they can't risk that. They can't risk their families, their children not being able to eat like that. So the people of America will also be relieved of the stress of constantly worrying about just what comes with living every day, which is you may get sick, you may have injuries, but you shouldn't have to worry about, if I do get sick, like I'm gonna have to pay this much money that could be going to mortgage, rent, food, anything else that could help them better. So the CRUM bill will also allow the U.S. to achieve a better standing amongst the list of wealthy countries and their healthcare expenses and their life expectancies. Currently on the list, we have the highest medical bills but the lowest life expectancies, which doesn't make sense because we don't have better or worse healthcare. That's not the case. It's just that people in America are scared of going to the hospital because they know the bills that they're going to face are astronomical, and they're just in fear. Well, in countries like Japan, who has a life expectancy of 84.9, almost 85 years old, more citizens go to the doctor, go to hospitals more than 15 times per year. Every year, people they're going to the hospital. While in America, when our life expectancy is 79 years young, really, 1 in 3 people have said that they've skipped medical treatment because of money. They're not going to the doctor because of money. And 1 in 3 people, that's enough. That's 1 in 3 lives that can be lost due to what they don't have enough money to pay for medical care, and that should just never happen. Bills are too high. It needs to be stopped. The funding for CRUM is going to come from the same funding that goes towards healthcare right now. Currently, we're spending $3.8 trillion yearly on healthcare, and that does not have to be the case. Coverage offered by the U.S. government does not have to be this high, because really all we have to do is regulate the prices that are set by pharmaceutical companies and hospitals and health insurance companies, because getting help does not need to be that expensive. Once the price is lowered, the U.S. government is not going to have to pay such high prices for covering Americans because the initial price will not be as high. So really, we're saving money instead of adding additional costs. That's why Chrome is such an all-around good bill. Well, there's going to be a lot of pushback from these companies, from pharmaceutical companies, such as, I'm sure Shkreli would not agree with this idea, but from those companies and from insurance companies, doctors, hospitals. However, if they do refuse to follow these rules and regulations, then they will not be authorized to provide health care or coverage in America to Americans, because really that just shows that they're just in it for money. If you're not going to lower your prices and still continue to help Americans, then that's not the kind of help that we want in America. Hopefully, this bill will be enacted July 1st, 2023. Thank you.